from the field, and we are here producing this from our Western Division consultation. And here with me, all the way from Vani, Tuvuki, and Jashnita, Reddy. I'll start with Vani. You have been sharing about access to health back in your community. Please, can you tell us more on this?
Yes, Francis. Health security is one of the many issues faced in the Ba district. And take, for example, I'll take you to a settlement in Ba, which is Koronubu. Koronubu is a settlement which consists of 4 main sub-settlements. And there are 1,500 hardworking farmers who live in the area with 1,500 households. 10% disabled people live there, 30% of elderly people, young mothers and children. The transportation costs for emergency cases to be taken to the nearest health center, which is 15 to 45 kilometers, is $25 to $50. That is why this is one of our main issues in the Ba area. There are other rural areas in the Ba district that face the same problem.
So when it comes to women, especially with pregnant mothers, accessing healthcare services, or sometimes when it's time for delivery, what happens in this situation?
Oh, Francis, it's a chaos because I'm just taking Koronubu for example, one of the rural areas in the district of Ba. There are no carriers available nearby, so households or families responsible for those pregnant women, they run around. If there is no fund in the mobile, then they have to go by foot to other nearest house. And Koronubu as a whole is a cane farming settlement. So one household will be about 2 to 3 kilometers from each other. So they'll run to the nearest household to be able to get telephone, to call the nearest carrier available at the place. If not, they'll have to ring right to town to be able to get that pregnant woman across. But otherwise, there's so many women who just gave birth, who are just giving birth at home, and some on their way to the hospital. And that is disastrous, Francis.
Thank you very much, Vani. So, in Koronubu, they have to travel all the way to Ba for the hospital, or do they have any medical health centers around that area?
No.
Closer?
They have no closer medical health center. They have to go right to Ba Health Center, and one is in Lamau, but it's the same distance to Ba Health Center. That is the nearest.
And when it comes to accessing healthcare facilities, affording medical medicines, and how do you deal with this, especially with the new scheme the government is having free medicines provided. So what is it that does this help the women, or
yes. Yes, we are thankful for the government for doing so many provisions, for giving us so many free supplies of medicine. There are certain households who have received free medical supplies, but there are so many out there who still haven't received because they have to fill certain forms to be able to get free medication. And free medication from the hospitals, from the nearest pharmacies. But if those medications are not available at the health pharmacy, then the health center pharmacy or the hospital pharmacy, then they'll have to spend money to go and buy it in the nearest paid pharmacy.
Are you part of this medicine scheme? Are you registered?
Yes, but I think we don't. I don't fall under that because I have a working husband whose salary is about 18,000. So my family and I, my children and I, we don't fall under that. They said that they will give it only to those who are under 18,000 plus.
Thank you very much. For our Western Regional Consultation last year, one of the issues that has been raised is about the medical scheme because it only provides a certain number of medicines. So what do you think the government should do when it comes to accessing all medical supplies?
Thank you, Francis. If we look at the national budget, the amount allocated for the Ministry of Health is 280 million and 23 million per division. And if we calculate, if I'm right with my calculation, then 3.8 million for the per district. So if we recommend, or I recommend to the government, if only one tenth of that 3.5 million could be used to upgrade or to construct medical centers and to buy more medical supplies and use for training of young women and youths in the area, and I think that would help women in the rural areas. If you look at the national gender policy, one of the main thing that we've learned from it is that we need to improve the quality of life of men and women, boys and girls at all levels of society. And also, we need to ensure safe, equipped, confidential facilities for the provision of healthcare services, which have adequate lighting and safe pathways. So, and also if we look at the Article 12 of CEDAW, it requires parties to take all appropriate measure in the field of health. This article further requires the parties provide appropriate health services. So this falls under these issues, Francis, and so if these are dealt with, and I think this issue will be dealt with too.
Thank you very much, Vani Tuvuki, for you, Jashnita Reddy. Can you please share with us, you have been talking about women's empowerment, the discrimination of women and young women. Please, can you share with us?
Thank you, Francis. My area is women's discrimination at workplace. I have seen so many places that even if a woman is qualified for a job, just because she is a woman, men tend to think low of them. Maybe because men think that women are not physically that strong. So even if a woman is qualified for a job, they will give her administrative duties. Even though the women can do a better job than that, but the women will be given a lightweight job, like in terms of in fields of engineering and marine engineering or civil engineering, a woman can perform better than a man. But just because men tend to underestimate the power of women, or they tend to undermine, even the community thinks that a woman is weak physically, but I have seen women excel in all fields of work.
Thank you very much, Jashnita. So what do you think we should be doing when it comes to this, as we have already approved in our national, Fiji has already approved the national gender policy, and there are still these kinds of issues that women, young women, and also the marginalized groups are facing back in their community. What do you think we should do in order to solve this problem?
Well, according to the Fiji National Gender Policy, it has 9 core areas of national gender policy, and under the employment and labor, it says create and revise where necessary legislations mandating gender equality in hiring, promotion, salary separation, and other conditions of work. And Article 5 of CEDAW also requires parties to address and change social and cultural patterns that reinforce the stereotyping of women and traditional gender roles. And Article 11 of CEDAW also requires parties to eliminate discrimination in employment as to ensure that women have the right to work, the right to the same training and employment opportunities as men, and the right to receive equal pay for equal value.
Do you think thank you for that, do you think when it comes to addressing these issues, how do we get the men involved and for us to work together? For the men to understand more about the value of women in their society.
Okay, so I believe women should pursue a career in the field of men and prove themselves in those fields of work, and I'm sure they can do better than what men are performing now.
Of course, we will do better than men because we are managers of our home, we do our own budget, we are the teachers of our children. So, of course, in a lot of ways, we are maybe a little bit or more better than men. But when it comes to, for example, Vani talked about health, security, do you face the same problem?
I'm mostly living in Suva, but when I come to my place in Moto, I see that people do suffer from health issues. Like I live 7 kilometers away from Bar town, and when a person gets sick, the Balaputu Health Center is mostly closed at the night time. So a person has to hire a carrier or a cab to go to Bar Mission Hospital. And then when you go to Bar Mission Hospital, either you won't find the nurses or doctors on time there, or there will be a shortage of emergency medication. I have come across where a patient was taken to the hospital and he was critically ill, and his daughter was advised to get medicine from the pharmacy so that the father can be treated. And we had to wait till 8 a.m. and the patient was taken to the hospital at 5 a.m.
When it comes to women and health, what do you think about that? Do you think women's health is important when it comes to national building?
Yes, women's health is important.
Okay, thank you very much, Jashnita, and for you, running of our segment for today, for you, Vani, Tuvuki, for the health sector. From what I'm aware of, they will only development takes place only. They will see the population. If there is a lot of people staying in that area, then they will be able to make changes or make developments in that place. Do you think this is okay, or do you think this rule or procedure should change?
Oh yes, we have the population there. We have the population in the rural areas in the interior of Ba, and these rural areas are very important because they are a part of the economic growth of the country. They are farmers, and I want to ensure, and I want to recommend to the government, do what is ratified in the CEDAW. It says in Article 14, it requires all parties to take all appropriate measures to ensure, that is the word that we are after, to ensure that the particular needs of rural women are met. So we are still looking for that now. We are still going after that word, the ensure, and this CEDAW has been ratified. So it's the government's job to see that it is done. So that is one of the most important emphasis that I would like to emphasize on today as part of my recommendation to whichever party that I'm talking to, and whichever level of leaders we are talking to. Please, the CEDAW and the National Gender Policy has been ratified. I think it's their job to follow up with it.
Thank you very much, Jashnita, Reddy, and Vani Tuvuki. Unfortunately, time has caught up with us, and here we are at the radio with pictures from the field. we're producing this from our Western Division consultation.